100% of the patients of leprosy will have a nerve involvement, so you need to know everything related to nerve involvement in leprosy. So this video is going to help you to achieve that. Hello dear students, myself Dr. Maddineni Srinivas. Welcome to Crack DrMSD. So if there is a patient having only nerve involvement in leprosy, we call it as pure neurotic leprosy, so there will be no skin lesions. So we have to biopsy a nerve to diagnose this condition. So we are going to use the radial cutaneous nerve for this purpose over sural nerve. What is the reason for selecting only these nerves? Because these do not have any motor innervation. And what will happen if you do a biopsy from a motor nerve? There is going to be a motor deficit. So there is going to be weakness. It's a problem. It will lead to medico-legal case. So that's the reason why we prefer these nerves which do not have the motor innervation. That is first point. And remember dear students, proprioception and vibration sensations are never lost in the patients of leprosy. My question for all of you, can you identify this nerve which is going to be enlarged in the patients of leprosy? This was a previous NEET question. If you know the answer, please put your answer in the comments below. So few points related to the tuberculoid pole and the lepromatous leprosy pole. What are the differences? In TT leprosy, remember the immunity is very good. So because of this, there is going to be rapid compression and also loss of sensation, nerve function due to the immunity. Whereas in the lepromatous leprosy, bacilli are more, so there will be slow invasion of the peripheral nerves. And coming to the symmetry, asymmetrical involvement will be there in TT leprosy, whereas symmetrical involvement is going to be there in the lepromatous leprosy patients. Remember, glove stocking anesthesia is very, very classical for lepromatous leprosy, and it is absent in TT pole. So peripheral neuropathy is the reason for the glove stocking anesthesia. And remember, sensory loss is going to be there in the TT leprosy, but the consequences are going to be very minimal. Whereas in lepromatous leprosy, patients are going to have trophic ulcers because of the lack of sensations. I hope all of you know this point. And what is the loss of the sensation order? So remember, sensory modality is the first modality to be lost, and that too it is not touch, but it is temperature perception, that too specifically hot cold differentiation, which is a sensation which is going to be lost, after which followed by which there is going to be loss of cold, hot, etc. So most common peripheral nerve to be affected in leprosy is, this is a very controversial, very doubtful thing, it is ulnar nerve over posterior tibial nerve. So overall sequence, remember, it is ulnar followed by posterior tibial. That's what is important for you to remember. And what is the most common cranial nerve to be involved? Remember dear students, it is facial nerve overall. And when a patient of leprosy has lesion over the face, then the most common cranial nerve to be affected is again the facial nerve. This is also previous year question, very important to remember. And blindness in leprosy patients is due to the exposure keratitis. Most common cause for the nerve abscess is, remember, it is borderline tuberculoid leprosy. And most common nerve prone to abscesses, again the ulnar nerve. Most common deformity which you are going to see in the patients is claw hand. Remember, wrist drop is due to the radial nerve involvement. There was a question about this, and there was some mistake given in one of the Q banks. So the answer for the image based question is greater auricular nerve. So I hope this video was helpful. If so, please do that like button and subscribe for more such videos. Happy learning. Sarvam Sri Krishna Sarve Jana Sukhna Bhavantu. Bye bye.